For the last 10 years, Bapu Trust has been working for urban community mental health in a few inner city slums of Pune. Pune district is one of the 35 districts of Maharashtra. Pune has a population of 10 million people. 42% of the city population live in the slums. There are over 550 slums in Pune city alone. The slums are the foundation of city life, providing all basic human services. Each slum has a unique character, depending on cultural, historical, social, and economic factors. Civic facilities, migrant status, kind of housing, density of population, social support systems, or social capital, and everyday living problems of people determine their quality of life and psychosocial experiences. Indian mental health system is focused more on mental institutions, using traditional methods of institutionalization, segregation, and treatment without choice. We wanted to develop a program that will respect the personhood, dignity, and choice of person with psychosocial disabilities. The entrance of United Nations Convention on Rights of Persons with Disabilities, UNCRPD in India in 2007 was significant in reviewing and redesigning our program. Article 19 of CRPD compelled us to think about transforming communities for the inclusion of people with psychosocial disabilities and to see the right to mental health care as a part of community development. Article 19 provides the right to live with dignity and choice in the community. People with disabilities have the right to choose their place of residence. They should not be forced to live in an institution. The government, at every level, has an obligation to provide a range of services in the community. We have a vision to create sustainable mental health in low-income communities through integrating psychosocial health into community development. A core objective of this program is the inclusion of people with psychosocial disabilities. We do not assume that families and communities can naturally give care and support. We enable communities to do so by providing information, knowledge, and skill sets. It is possible to multiply and increase emotional resources in the community through inviting all actors and agencies in the community to participate. This is our main practice. In this way, we enable people with psychosocial disabilities, especially those with high support needs, to be fully included. When we began in 2005, an expert psychologist would visit the communities once every week. She provided counseling and psychotherapy. But there was an imbalance between community and service provider. It was an expert-driven model. For people with psychosocial disabilities, there was only medical care. Now, we have a nested program linking mental health care, community development, and inclusion. We aim to transform communities on principles of inclusion. It has taken us 10 years to experiment and innovate. Patience, faith in community, new knowledge and practice takes time to develop.